Logan, this is Dr. Tony. Let's talk about today is part 3 of the Xray analysis of understanding scoliosis. Okay? In this example, you'll see a video in a second, it talks about Riley. He's 6, again checked at 10, again at 12. Why so young? If we can catch it early enough, under 15-20 degrees, allows us to correct it naturally without bracing, without surgery, and that's why his mom, Carrie, let us check him based on she had some signs of that too. Okay, so watch the video and see, but realize early we catch it, it's not age related, but more on degree of scoliosis is where we have the most effect, and sometimes as a parent it's hard to see with the naked eye. So get your children checked, see what's going on, and we'll see you after the video. Once we find the exam exactly what's going on, if there's positive signs of scoliosis, we want to do an X-ray almost right away and see exactly what's going on with the spine, if there's a curve or not. As you can see in the image next to me, the medical approach is if that scoliosis seems like it's very minimal, say under 25 degrees, the goal is to observe and wait, maybe 6 years old, 10 years old, 15, 20 years old, and see if it does progress above that 25 degree range. The problem is once you get there, then you start bracing, and at that point require surgery, which can cause complications down the line. Our job with the X-ray is catch things if possible between 5 and 10 degrees, the most 15 degrees. With this X-ray here, this is Riley's X-ray at 6 years old. The mom had brought him in at 6 years old, and we kind of saw what was going on with the exam, and we took the X-rays. With the X-rays, you can see in there, it's about 9 degrees of lower scoliosis and 7 degrees of upper scoliosis. That's high enough at 6 years old, because the body will grow to about 21, 22 to progress through those range of 10, 15, 20, 25 degrees to require surgery. Our job was at that point at 6 years old for Riley is control it and monitor the progress with X-rays and treatment to make sure we maintain that. In his second X-ray here, you can see at 10 years old, we took some between two, can see that progress where we're keeping things down to about 5 degrees, 6 degrees. Again, the range of normal at his age at between probably 6 to 10, 12 years old is between 5 and 10 degrees. You want to maintain that. That point doesn't get out of control as he has growth spurts. On his last X-ray, you can see here, the present X-ray at about 12 years old, we're seeing it stay between 7 8 degrees, and that's the range you want to maintain, that between 5 and 10. That's control easier, okay, to keep his body healthy, and keep his body from causing other complications such as heart problems, back pains, problems that would require down the line surgery. So again, the goal with chiropractic is to maintain that controlled and routine X-rays and examinations to make sure we can treat them enough, maybe once a week, twice a week, once a month, to make sure we monitor that enough so it actually stays at a lower degree and doesn't require the surgery and the bracing that can cause complications, permanent complications down the line for that child. So I hope you can understand why the X-ray analysis by a chiropractor is very important to see, and since our perspective is how do we correct it naturally, especially under 15-20 degrees. Okay, our job is to make sure we catch it early enough by having you as a parent understand what to look for, what signs to look for, understand how to examine your own child if you can. Also from there, the X-ray analysis will help prove or hopefully rule out problems with scoliosis and hopefully postural issues too. Okay, hope you watch this video, and any questions please let us know. Make sure you watch part 1, understanding scoliosis, part 2, the X-ray examination too. So all 3 together helps you as a parent understand how to keep your kid healthy. Okay, enjoy health from the inside out. Have a great day. Thank you for all the reviews and comments.